Welcome back to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. Our topic today is overweight and obesity, a major concern right here in Monterey County. As our last guest revealed, Monterey is one of the 10 California counties whose prevalence of overweight and obesity among children and adolescents has grown to exceed about 45%. I'd like to continue our discussion by introducing my next guest, Senior Health Educator at the Monterey County Health Department, Ms. Linda McGlone. Welcome, Linda, and thank you for being here today.
Thanks so much for having me, Emily.
Absolutely. Another familiar face to the camera here. So, Linda, what are the community-level issues that impact access to healthy foods? Dr. H just kind of was talking about that, and we'll pick up right where she left off.
Yeah, thank you. No, I think she set the stage for this, and there's a number of things that limit people's ability to eat healthy foods and to get out and exercise. So it's everything from ads marketing sugary cereals to children, and parents' ability to go grocery shopping and to buy fruits and vegetables in their neighborhood. So in a lot of urban environments, you'll have a corner store. You won't have a nice big Safeway with a huge produce section. Corner stores, small stores, convenience stores don't want to carry fresh because it goes bad and it's a loss for them. School food, we're hearing a lot more about school food. High calorie, poor quality, and not much in the way of healthy or fresh fruits and vegetables. In terms of exercise, Dr. Hernandez began to refer to this, but some neighborhoods it's not safe for kids to go out and run around. They have maybe gang activity, or it's a high crime area, or the sidewalks aren't safe, or the parks aren't safe. So there's a number of issues in the community that limit people's ability to keep their weight down through diet and exercise.
Interesting again. So what are the options for low-income families living in urban areas where fresh fruits and vegetables are hard to find, kind of like the corner market, corner store scenario you just described? What are their options?
So what makes it difficult is, imagine you and I do our grocery shopping, and we always would take our car, right? You put the groceries in the trunk and you pull up to your home and you unload them. Well, a lot of folks in low-income neighborhoods don't have cars, so they would have to rely on a bus or maybe even a taxi to get to a better grocery store that's out of walking distance. And then you have to schlep heavy produce, bumping around on public transit, and that's really difficult. To overcome that, there's been a number of innovations lately. So, for example, you have Walmart and Target offering fresh produce in their store. Once they get you in their store, they want to keep you. So you can do your grocery shopping there, which includes fresh fruits and vegetables.
I've seen that.
Yeah, it's remarkable.
Yeah.
And it just, again, removes a barrier to access to fresh. Walgreens, historically a drugstore, is offering fresh fruits and vegetables in some inner city neighborhoods. So my sister lives outside of Chicago, and her Walgreens in Oak Park, Illinois, has fresh produce.
Wow.
Yeah. Again, making things more accessible. Food stamps. In California, we call food stamps the SNAP program. Making it easier for more vendors to accept food stamps. So just as you and I like to go to the Monterey Farmers Market, farmers markets are being offered in low-income areas. So, for example, our WIC, Women, Infant, and Children Nutritional Program, has a farmers market once a week, and you can use food stamps to buy fresh produce at certain farmers markets.
Wow.
And then, believe it or not, urban gardens, community gardens. One city with a fairly sophisticated system of urban gardens and farmers markets of produce grown in those community gardens is Detroit, believe it or not.
Wow. We've heard that Cars, Violence, the rapper Eminem, they come from Detroit haven't heard about that. Urban gardens.
Right.
I like that. And adds a sustainable element to the community as well. That's really neat. So I've heard a lot about food deserts on what Fast Food Nation, that movie. The impact of food deserts on choosing healthier foods was challenged recently by the New York Times. How would you respond to that article?
So a food desert is a place where you can't buy, you don't have a grocery store, you have a very limited corner store, perhaps. So I can think of some small, or at least one very small rural community, probably two in southern Monterey County, where you cannot buy fresh fruits or vegetables. So if you go into the only store in town and you say, do you have an apple or a banana or something? No, absolutely not. Maybe the liquor store has a lime or two, but that's as good as it's going to get.
Hard-boiled egg.
Yeah. So the New York Times said, well, they challenged the notion that simply because you can't purchase fresh fruits and vegetables in a town doesn't necessarily mean that if you had those things, you'd buy them. So Michelle Obama, I think, brilliantly pushed back and said, wait a minute, you don't know what these access issues are really like. Again, folks not having a car, having to hire a taxi or ride the bus to go get something that fresh fruits and vegetables that's some distance away. So I think they underestimated the access issue in some of particularly poor neighborhoods, and what compounds this problem is in low-income neighborhoods, there's lots of fast food outlets. So in your neighborhood, my neighborhood, we aren't going to have a McDonald's on our corner. That would not be allowed by zoning, nor by the community's preferences. But in these poorer neighborhoods, there's so many more fast food outlets. And fast food outlets are good at selling a lot of calories cheaply. So if you go to In-N-Out Burger and for $2.19 you get a cheeseburger, you're full. But if you took that $2 and said, okay kids, we're going to have $2 worth of broccoli tonight, your kids aren't going to be full, and it's not satisfying in the same way that the fast food calories are. Interesting.
I guess it's not only just going out to get healthy foods. If you had to take a bus or a cab, people may be like, well, it's not that hard, but it is, because you also have to live your life. You also have to go to work, raise your family, you know what I mean, maybe go to a second job, do schoolwork, do whatever you have to do. And so yeah, taking that trip to the really far away grocery store to get fresh food, it's definitely takes time out of your life, and it's inconvenient. So tell me about the New York City proposed ban on large-size sugary soft drinks. Is this something we're doing here, or we're far from that, or?
This is Mayor Bloomberg, the mayor of New York City, who has proven to be an amazing advocate for health, has proposed a ban of soda, soft drinks, or other sugary beverages in the very large 16-ounce or greater containers.
Wow.
So those can't be sold at sporting events, movie theaters, or in restaurants. And of course there's a lot of pushback. This is where people start complaining about the nanny state. So now what are they going to ban next? Large pieces of pizza, 16-ounce steak, that sort of thing. But he felt, and I think he's on solid ground, that that went a long way to reducing obesity, because there is a lot of calories, particularly in a large 16-ounce, and oftentimes those things are refillable.
Oh yeah, and 16 ounces is like the smallest size that you'll find at 7-Eleven. There's super big, great, huge gulp that's, 16
Right.
ounces times 5, and that's like the second largest one or something.
And that'll fill you up too, and when those calories, obviously bad for your teeth, obviously high in calories, fill you up so that you don't have room for healthier food and that sort of thing. But I think people forget we have a history in public health of limiting access to things that are deemed unsafe or bad for your health. So when the motorcycle helmet law came into being, people said, well, I should have the right to go and blow my brains out on the highway, and you can't tell me what to do. But as we know, those medical costs come back to all of us. So when there is that tragic motorcycle accident, we end up paying because the costs of keeping that person alive, putting them back together are so extraordinary that no individual could do that. Well, when you start to look at the numbers of this obesity epidemic, the healthcare costs are off the charts. And so, again, we'll all be paying for the person whose lifestyle includes the 16-ounce soda every couple of days.
Absolutely, and with the numbers that we heard in the previous segment, you know, you have a 80% or greater chance of being obese as a child if both your parents are, and then an 80% or greater,
yes,
or an 80% chance of being obese as an adult if you're obese as a child. I mean, this is something, the costs are only going to increase if if things stay the same as how I'm seeing this, you know, unfold. If things stay the same. So how can communities increase residents' ability to be more physically active? What needs to happen in order for people to get out there a little bit more?
So weight loss or maintaining a healthy weight is both what you eat and then how active you are. And it's striking that balance between calories in and calories burned. So we want to look at people's ability to be physically active. And a phrase that you'll hear is creating more walkable communities.
Okay.
So are the sidewalks in place? Some neighborhoods don't have sidewalks. I live on a really steep hill and we have no sidewalk. And as a result, I wouldn't let my child walk to school because it's also a fairly busy street. Encouraging kids to walk to school is a great way to burn calories and a natural daily opportunity to be active. Bike lanes. Are there bike-friendly, is your town a bike-friendly town, or are bicyclists dodging cars every which way? And then use of the parks. The parks are a place for kids to get out and play, families to get out and play. But again, if your park is not safe, if your park is really in the hands of drug dealers and winos, then you're not going to let your kids go play there. And communities need to make an effort to try and take back their parks and have community events, have family picnics, and let criminals know that there's so many more good folks in a community and that they have a right to that park, and kind of nudge the criminal activity out.
Interesting. So you mentioned physical activity as well as food choices. We've heard a little bit about environments, and I want to know more about that. How can communities, or why focus on community environments? I mean, you just mentioned take back your park. You know, once there's positive things going on there, it'll send a message to the negative people and the negative things they do. But why focus on community environments? I mean, isn't it up to the individual to kind of lose weight, or how is this? How does that work?
And it's a balance. I mean, for years we've blamed people for being obese, blamed people for smoking. And if you take a page out of the tobacco playbook, what they've done is made the environment less supportive of smoking. So we know you can't smoke in a restaurant. You can't smoke in parks. Cigarettes are very expensive, and that is another way to limit access. So what they're trying to do in terms of this obesity epidemic is to create supportive environments where if you want to make the healthy choice, you have that opportunity. But if your store, and if it's a big ordeal and you're tired and you worked all day, as you said, and you have to, you know, go 20 miles to the nearest full-service grocery store, you're not going to do it. And you really can't be blamed for that.
I see. So that, you also mentioned school meals. Now that, I've definitely heard a lot of buzz about that lately. What are the recent changes from the USDA regarding school meals?
That's probably the most dramatic change that we've seen, and I think public health is really hopeful that that will start to bend the curve on the obesity epidemic. Many schools ordered their meals from airline food companies. So when the airlines stopped serving food, a lot of these same companies went into school food. And so what school food consists of is stuff that's pre-cooked, arrives at the school once a week, comes out of the freezer, into the convection oven, and out. And so there isn't an opportunity for kids to try fresh fruits and vegetables. So probably the biggest changes in school food is more fruits and vegetables. So they're going to double the amount of fruits and vegetables at lunch, and then double the fruit at breakfast, and that will start 2014. The increased fruits and vegetables for lunch starts this fall. And the challenge there for schools is really significant, because schools, because of this airline food concept, don't have stoves, don't have big refrigerators, don't have people to cook and prepare the food anymore.
Right.
So I think that's the biggest thing, increasing whole grains and emphasis on dark green leafy vegetables, which is great for the Salinas Valley, the salad bowl of the world, non-fat or low-fat milk, and they can offer juice, but they can't offer juice more than once a day and only as half of the required fruit serving, because juice seems healthy, okay, fine, but has a lot of sugar in it and very high in calories, so they can't load these kids up on juice, even if it's 100% fruit juice.
Right, or nor counted as part of the fruit is what you're saying as well.
Yes, exactly.
Okay.
Yeah.
So we have just a little bit more time, but
okay.
I've heard, again, I've heard that it's easy to increase access to fruits and vegetables in California because so much is grown here throughout the year. And you mentioned Salinas. What about other places? What about the Midwest? What about other areas where fresh is not bountiful?
So we had a visit from the USDA, and she said, well, in California this is fine, but you're not going to make this happen in North Dakota. To which Lori Koster, who runs Man Packing, one of the biggest grower shippers of broccoli in the country, said, if you've got a McDonald's in your town, we can get you fresh. So the distribution system is in place to serve tomatoes and lettuce at your McDonald's, and the ability to move fresh, that distance is also in place. So we can do it. And the Salinas Valley is the heart of innovative packaging and the heart of many of the fruits and vegetables that the USDA wants kids to eat more of.
So that's great for us here in Monterey County.
You betcha.
And that's great for the rest of the United States as well. Win-win, I like that.
It's a win-win.
Thank you. So Linda, that's about all the time. Unfortunately, we're going to have, I'd love to sit and talk with you more and ask you more questions. Thank you again for talking with us. It's a really complicated problem, and I think you've kind of provided some good insights, really great insights for our viewers. Thank you.
Oh, thanks for having me. Really appreciate it.
Absolutely. So right now we're going to take a short break, but don't go away. We'll be right back with more of the Your Health television program.